For the second day in a row, fewer than 1,000 new coronavirus cases were reported, and hospitalizations are at the lowest point since November. But the big problem still remains. The state does not have enough vaccine supply to meet demand. Right now, less than 3% of the state's population is fully vaccinated. People are signing up on multiple waiting lists, hoping to get their shot. Maryland's top health official says once you get an appointment, take yourself off the other lists.
To get on a waiting list, and then as appointments become available, they will be in line to get an appointment.
Some local health departments report getting fewer vaccines than promised, forcing them to reschedule appointments. The CDC says you have up to 6 weeks to get the second dose.
In Baltimore City, officials are meeting to figure out what can be done about issues surrounding the coronavirus vaccine there. Now, this includes everything from the number of doses received to appointment problems. WJZ's Live this morning, Annie Rose Ramos has more on the investigation being launched by the City Council. Annie Rose.
Hey, Tim, good morning. City Council members say they're disappointed to hear just how many frontline workers have had their appointments canceled. Now, there are many issues, including overbooking and the desperate need for more supplies.
I've lost sleep over this botched rollout. I am sick to my stomach.
Nearly 2 months after the first doses of the COVID-19 vaccine arrived here in Maryland, a city council committee met with health officials. It's investigating the problems plaguing the city's distribution plan, starting with the hundreds of appointments canceled last week at Baltimore City Community College.
Right now, there's no bigger failure in this rollout than the potential loss of life of these vulnerable people that has been chalked up to technology issues.
Health Commissioner Dr. Leticia DeRaza says all those people were turned away because they made their appointment with a link they never should have gotten. It was shared with them by an unauthorized person.
Issues with PrepMod are things that we brought to the state's attention for weeks, and they have largely gone unfixed.
As of right now, only about 8% of the city's population has been vaccinated. That's below the state average. Dr. DeRaza says it's not just overbooking. They're also dealing with a lack of supplies.
Unfortunately, at this time, given the scarcity of supply of vaccine, we aren't able to guarantee an appointment at our vaccination pod.
The meeting also addressed things like making sure city residents are getting the vaccine instead of those who just work in the city, and setting up mobile sites to help reach people who can't get to a vaccine site. Now, Lynn, health officials say in terms of fixing those issues with their website, they've brought their concerns to the state, but those issues have yet to be addressed. Reporting live from the Baltimore Convention Center, I'm Annie Rose Ramos for WJZ.
Annie Rose, thank you. Harford County releases its plan to bring students back into the classroom. The week of March 1st, pre-K through 5th grade students will have 2 days a week for hybrid learning. On March 15th, 6th through 12th grade will have 1 day for hybrid learning. The hope is in April, elementary students will get up to 4 days of in-person learning. And Baltimore County schools are also reopening at the same time. The staggered approach will take about 5 weeks. At a virtual school board meeting last night, leaders provided an update and tried to reassure everyone it is safe to bring students back.
School administrators and their reentry teams receive extensive professional learning to support the development of a school-based reentry plan.
Families who are not comfortable sending students back to the classrooms will still have the option for virtual learning.
It is 5:39 now. Anne Arundel County Executive Stuart Pittman is in quarantine today, this after being exposed to someone with COVID-19. Pittman says it happened last week. So far, he's tested negative and expects to be finished with his quarantine later today.
Masks are now a part of our everyday life, and for some people, they cause skin issues and acne. Our skin is not used to having a piece of material covering our face, trapping moisture and bacteria against our skin. Dermatologists suggest proper hydration, keeping makeup off the skin that's covered, and washing your mask after each use.
I know how it feels that when you go home and you have to take off your mask and your skin is not how it used to be. That's a huge struggle. It's nothing to really be embarrassed about either, especially if you're looking to get help. That's why we're here.
Everyone is different, and treatment is a case-by-case basis. If over-the-counter washes and creams don't work, you should call a doctor to get help.